Hi everybody, it's Dr. Lou Walters at the Source Wellness Center. Today's health topic is on the importance of gut health. So our GI tract is responsible. We have to first break down the food that we're eating, then we have to be able to absorb it, and then we have to be able to eliminate wastes. If that isn't functioning properly, any of those steps, it's going to have a tremendous impact on the rest of our health. So it doesn't matter how good your diet is and what you're eating. If you're not digesting and absorbing it, it's just passing through. Our bodies, we can't live in our own waste. So if we're not eliminating our wastes effectively, then that's going to accumulate and interfere with normal cellular function and can even contribute and cause chronic diseases. So we want to make sure that that is working properly throughout the system. So taking time to sit down and relax when you eat, chewing your food well, 31 times per bite, not drinking water and liquids with your meals so you don't dilute your stomach acid, really focusing on the food and not being distracted, not driving or watching devices or TV or reading. You really want to focus on the food when you eat. And then we also need to talk about the microbiome, the bacteria that live in the intestinal tract. We have more bacteria in our intestinal tract than we have cells in our body. And we want to make sure that we have good bacteria, health-supporting bacteria that we have a symbiotic relationship with. We give them a nice warm place to live, and then they do some nice things for us to help our health. Now, when it comes to gut bacteria, many people just think about their digestion and their pooping being good or bad, and that's all that it does. But it actually has the gut biome has a much bigger impact on our overall health. It has a big impact on our immune system, since anywhere from 55 to 80% of our immune system lines our GI tract at any given time. And if we get inflammation in our gut, it'll spill over into other places like our brain. It also has an effect on our neurotransmitter production, the little protein signals that make us feel happy or sad or communicate things in our brain. A lot of that is affected by what's going on in our gut. So we want to make sure that we have good gut bacteria. So either by eating fermented foods or taking a probiotic, all of that is going to be important as far as gut health. When we talk about getting sick, a lot of people just default setting, no matter if it's viral or bacteria, they'll take an antibiotic. And a viral infection, that's not going to help the infection at all, but sometimes people still take it because they have it in their head that that'll make them feel better. When we take an antibiotic, whether it be for a viral infection or a bacterial infection, it doesn't just kill the bad stuff, it kills the good stuff too. And some people think, well, I'll just take a probiotic for a few weeks and that'll fix it. It can take minimum of 3 months to replenish and replace that gut bacteria. For some people, and for a lot of people, I should say, it's more like a year of taking probiotics just to replenish that one course of antibiotics in their GI tract. And if you take multiple antibiotics courses, it's going to do even more damage. So when we're talking about gut health, we're really talking about overall systemic health. Everything in your body is affected by the nutrients that you're absorbing, by that gut bacteria. So when we're talking about other areas of health, even if you're not having, you're pooping fine or you're not having heartburn or gas, it doesn't mean there isn't imbalances in that gut bacteria that could be affecting issues in your health if you're having symptoms in other areas of the body. So you want to make sure that you focus on your gut health. I can certainly help you with that. If you would like, you can always call the office to set up a consultation. Number's 406-551-6175. Best wishes and be healthy.